welcome back to the Nutrimedical Report, and Ryan is with us to discuss some of the more advanced protocols and, of course, the uniqueness of our nutraceuticals, which are always upgrading. And we've upgraded, of course, our Ageless Energize, Immunomax, and NutriImmune, which all contain the immunoglobulins, lactoferrin, colostrum, transfer factors, etc., one of the most important immune modulators and improvers to prevent infection, to prevent autoimmune disease and cancer that you can get. And they're very unique. We have formulas that no one else has been able to copy. By the way, I want to mention that I heard a commercial for Heart and Body. People should realize that we have the original formula, which is Cardivite. It is checked literally every batch with high-pressure chromatography, so it is the formula that I take. I don't recommend any of the nutraceuticals that are often broadcast on my show, but I do recommend our nutraceuticals because they're the best. And if there's an improvement we can make in a formula, we do. And we move forward with that. We have some new products coming out this fall, and I'm working on our eye formula as well. So, somebody's taken a number of months in order to launch them. You have to find the right manufacturer, right source for your different formula, and you have to have exclusive contracts if we have a supplier, especially if it's overseas like in Europe. So, Ryan, let's start off with some of the... What are your favorites? I guess this is a good time to kind of ask your favorites again, because I just finished going over a lot of the... in the last hour, I covered a lot of news, but I also went over a lot of not only our products, but many of the other ones that we carry here at Nutrimedical.
One of my all-time favorites is that it's kind of a newer one. Is Tendon Mender.
Yeah, that's a good one, isn't it?
I'm enjoying it. I enjoy it personally, and I know a lot of people are also enjoying it because I'm a person that's had some repetitive motion injuries, specifically around Achilles tendinopathy, and it's just amazing what I found personally Tendon Mender to be helpful with. But clinically, in the research that's been done with this nutrient, a very unique molecule, isolated basically from specific glucosaminoglycans that are derived from rooster combs. But this specific molecule, when you ingest the product, basically is giving messages to our tendons, or tenocytes, I should say, the cells that make up the tendons, and allows them to basically, calm down their inflammation. A lot of times what's happening is they're thickening, and that's a bad thing. Normally you think, thicker is better, that's stronger, right? No, that's not the case. If these tendons get thicker, they don't move well, and they create more inflammation and more pain. And what happens is after you have an injury, chances are that that's what's happened is it stays kind of swollen, if you will, and it's thick, and it's almost like, behaves like scar tissue. And Tendon Mender is exactly that. It changes and mends the way that these things kind of lay back down, realign themselves, and all of a sudden you're starting to get your function back, mobility back, range of motion, and not suffering the same levels of pain and inflammation. And it's a very fast-acting formula as well, and easy to take, just 2 a day. It's a great formula. And I think people with, carpal tunnel, shoulder issues, you call them frozen shoulders, or tendinitis, elbow tendinitis, knee issues, things like plantar fasciitis, which I know, there's so many people out there trying to, figure out which Dr. Scholl's foot pad they're going to put in there, but you really need to fix it from the inside out in a lot of cases.
Exactly. You don't just get a custom orthotic. You need to fix the biochemistry.
People, right? You end up on a brace. I mean, even if it's the thing, it's the band, right? A tendon band you put around your knee or your elbows or whatever, or you're a cashier and you're wearing wrist guards, while you're working. It's like, you can really change this. You do not have to live that way. So that one's pretty exciting, and I would kind of couple that also. A lot of these people with inflammatory challenges, the Inflamex formulation, which is the proteolytic enzymes, that's been very powerful for bringing down challenges that happen both in acute and more chronic issues. The enzymes are so interesting in what they can do systemically in our bodies.
Yeah, exactly. Now, one of the other ones that goes with us is Joint Performance, which is going to help rebuild your cartilage. Collagen Max to triple the rate to reach collagen regeneration. And the use of things like our Mountain Red Velvet, anti-inflammatories like Inflamex, which is a Wobenzyme N formula, 10 times more powerful with serrapeptase added. These in various forms are really useful to help. And what I'll often do is I'll get started off with a triad of Tendon Mender, Joint Performance, and Collagen Max to get people healing. If there's a lot of additional inflammation, I'll add Inflamex and Cell Defense. The Inflamex, of course, is an enzyme that will break up interfascial adhesions and get rid of debris blocking lymphatic vessels and veins, etc. And the cell defense is curcumin, which is with bioperin, the best form in the world to actually turn off precancerous changes, inflammatory changes, and of course topically around joints. We use the curcumin cream, which is one of the best topical things for turning off sunburn, the swollen sore joints, carpal tunnel, ulnar tunnel syndrome. It's really quite amazing how effective the curcumin cream is. And of course, if they need to, we'll add to that with Magna Smooth, which is Arnica montana, etc. But the triad I like to start off with is Tendon Mender, Joint Performance, and Collagen Max. That's a good triad, isn't it?
Oh, very good. Joint Performance, wow. Here's a formulation that, as people start getting, you call it the weekend warrior syndrome, they're sort of slowing down on their recovery process. They're not getting as much out of their performance. Their joints in particular, they can feel that they're getting slower. Their range of motion is being compromised. What's so neat about Joint Performance is that's one that's been studied for increasing the hyaluronic acid levels in the joint. So basically it allows you to retain a lot more fluid. It's, a lot of the ways it's like an oil change that you'd have on your car, except it's for your joints. And that's a neat thing to get to, because if you can't change that oil, what happens is you end up with, less and less viscosity. You're starting to get, kind of less and less, or I should say greater friction going on in your joints. And that's what's going to perpetually happen and break down the joint tissue until you end up with, catastrophic things like bone-on-bone destruction of cartilage. And it doesn't have to be that way. You can alter the course of it versus just popping non-steroidal anti-inflammatory drugs, which are only covering and masking the problem, like kind of putting a black tape over the edge of
they'll actually speed up the process of degeneration. We know they interfere with glycosaminoglycan regeneration of your cartilage. They'll interfere with the collagen proline transhydroxylase that actually cross-links and forms all different 29 subtypes of collagen in your body. There's 29 subtypes. If you ask the average orthopedic surgeon or physiatrist how many subtypes of collagen in the body, they're totally boggled. If you tell them which enzymes are necessary to actually make the different collagens, like what type of collagen's in bone, 42% dry weight is type 1 collagen, which again is why we use Tendon Mender for regenerating bones, along with our MyCell D3, Myco D2, full vitamin K2, and of course Bone Generator, which is the actual crystals that are going to regenerate bone, because it's the calcium, magnesium, hydroxyapatite, 7 water molecules, 2 calcium ions, 1 magnesium ion, and the proper ratio with all silica, boron, manganese, etc. And you can't make bone unless you have bone crystals. If you take other forms of minerals, you're going to end up with metastatic calcification of calcium. But we approach musculoskeletal injuries that way, and then we do a non-traumatic exercise like I call vitamin VX, which is vibrational exercise, range of motion exercise with body elastic bands. While you're on vibration, you're taking our nutraceuticals, you're going to get better than if you add lumen photon therapy, pulsed magnetic field with SomaPulse. You're going to speed the absorption of these nutrients to the right tissues, and if you have hypoxic areas in your body, you want to do mild hyperbaric oxygen, and you can even do oxygen augmentation with a Respironics, oxygen concentrator hooked up to your mild hyperbaric chamber. In fact, I get in for about an hour today before the program. And does it ever calm you down, make your brain just kind of whiz? It's almost like you become so efficient. It's almost like, and it shuts down inflammation along with all the nutraceuticals. I take a little cup of nutraceuticals in the morning, and I take a few less later on in the day, but it makes a big difference. And when I do my QRMA test or my functional test through Genova Metametrics labs and other labs like Dunwoody labs, which we will have on the program, you can validate that you fixed your chemistry. You're not just playing around with a few numbers like a quote comprehensive metabolic test that your doctor will do, which is very, very superficial. You want something much more deep. And we come back, we'll hear more from Ryan and amazing NutriMeds and how we apply them. Stay tuned. Welcome back, and of course remember out there, if we're talking about NutriMeds, you can call in specifically with NutriMed type questions. When we have open lines the first hour, it was on any topic, news or NutriMeds or anything. I just have to tell our board op today it's John, covering for Randy. And the number to call is 800-259-5791. This hour, of course, we're going to continue talking about amazing nutraceuticals and wellness applications. It's extremely important to protect your health. Your best asset is your health. And I mentioned on one of the previous shows, I think last week, that people spend their youth trying to get wealth, and then they spend their wealth trying to get their youth or their health. So a lot of people, they're young people actually, when we do QRMA or functional medicine tests, they're eating garbage, they're not taking care of their health, and they're actually physiologically aging at a very rapid rate. And we see elderly people that are doing excellent things, taking care of their health, restoring their nutrients. They've been through sometimes a scare, they maybe had cancer or heart disease or other problems, and realize that they're responsible, like Confucius say, beyond 40, the countenance of a man is determined, or woman, by how they take care of themselves, what they eat, how they exercise, etc. And, of course, that means NutriMeds. And it's not really optional in our toxic world to think you can get an adequate diet alone with organic foods, whether it's organic vegetarian, vegan, organic, if you want to call it non-vegetarian type diet. For example, I tell people, if you're going to have chicken, make sure it's organic, free-range chicken, or ones that are not raised with non-organic feed, because it's going to contain arsenic. The amount of people that are full of heavy metals, toxic volatile chemicals is obscene. And when people say that they disagree with me, I said, well, we can start off with a QRMA test, which is a fantastic screen. And what is follow up, as I said, we can do actually toxicological tests on you and find out. In fact, if they want to do a test, they can get the breast test done through the Environmental Health Center of Dallas, EHCD. I just heard also a notice that the tech issue has been solved here at Genesis Network, so people can go directly with their iPad and they will be able to listen to the programs, no problem. So they don't have to download a download manager. Everything is good. So fewer clicks to listen to the amazing shows here at Nutrimedical. So I hear a lot of people that try to integrate what we call functional medicine with advanced medicine. The problem is that a lot of doctors either don't know the advanced medicine and all the different specialties, which I do, or they're lazy, which a lot of doctors are. Their doctors are treating cancer or doing pre-ops or surgery. They're not doing the proper screening evaluations. And they don't prepare the soil. So if you do plastic surgery and you've done fixed the biochemistry of someone who's hypothyroid or has got lipid disorders and they're pre-diabetic, they're not going to get a good surgical response to your treatment. And that's why our NutriMeds are so important. And this basically should be not an optional thing. Every doctor should understand functional medicine, whether you're a surgeon, an intensive care doctor, internal medicine, pediatrician. I think we should be working on people's immune system with things like Immunomax rather than pushing more and more stacked vaccines, assuming that you can give a child the proxy of 5 or 6 deadly diseases and expect their immature immune systems to develop an adequate response of cellular and humoral immunity. And no one's ever validated, actually proven with an individual, either animal or human, that they've increased a anamnestic response of antibodies or T-cell clone that have increased in numbers after exposure to a secondary pathogen insult, or another coming back into the body, or taking an illness like hepatitis and removed it. So because those we call scientific markers have never been crossed, we really don't have what we call true vaccines. Vaccines that I propose could be made the same way as we want to reverse heart disease. Well, we know that the only thing that can form plaque is unstable oxidized cholesterol and oxidized fatty acids. So, Ryan, let's talk about some of the things we have to stop that. We have Supernox. We've got our fatty acids. I tell people fatty acids are not a minor thing. Phospholipids, Neurogen, omega cod liver liquid. When I make up my drink, and someone asked the other day, how do I make it? And I said, well, I pour an awful lot in my Ninja blender that'll last about 3 days, for 3 days to 3 days and a half, 3 days and a bit, for my special drink, which I make up. But I'm putting probably 50, 60 mils of omega cod liver liquid in there, besides the omega fatty acids I take every day. I take at least 2 of the big omega supreme, at least 3 of the omega supreme krill, and of course Neurogen and Nutrifos. So when I had my lipids tested through Metametrics Genova Labs, they were saying, wow, you've got fantastic lipids. I mean, my cholesterol was 171. I mean, how many guys my age have got a cholesterol 171?
Just the ones on major meds, Dr. Bell, but they're also
major meds that are frying their brain.
They're also getting Alzheimer's and probably a lot of other problems. The other term for MD stands for more drugs, or multi-drugs. So the fact is, these are non-thinking doctors that are lazy.
If you want to fix the chemistry of the patient, what's their heavy metal load? They got heart failure. What's their nitric oxide production? Get some Berkeley test strips and test the back of their mouth. Are they on Cardivite and Supernox? Supernox, you can increase the dosage. 2 tablets 3 times a day, use the average, but we have to increase it in some people. And you can also increase that if you're taking tetrahydrobiopterin, you can increase it with things like Samethyl. Because, again, remember, it's a methylation reaction. Tetrahydrobiopterin requires methylation. So if you take Samethyl, you're going to increase your levels of, guess what, nitric oxide. Because it's tetrahydrobiopterin, which we also have for depression, is in our Pteridine 4. So, Ryan, there's no excuse for this kind of sloppiness, is there? And validating with organic acids, gene tests, and other things, it's obscene that these doctors call themselves health professionals. They're not. They're pencil pushers.
I certainly, as you say, there may not be an excuse for it, but there's certainly a reason why it's happening, and that's because, there's money to be made off of people not knowing any better. So, God bless you for what you do, and try to help people understand that there's a different way to get to the source of the issue. And like you said, a billion times, it's not curing it, it's giving the body nutrients that it's missing, which is creating the problems. In many cases, it's not that drugs have to be banned forever. It's just use them at the appropriate times. Most people,
use them to rescue
it. Into it.
Yeah, in other words, if you have somebody that's just neglecting themselves, use the drugs if you have to rescue them. Once you've rescued them, start fixing the problem. If they're having serious hypertension or if they're diabetic, get them on glycemics, get them on carbo blocker, give them lipoflush, give them diabetoline and biotin plus, and then start reversing their insulin resistance. You can measure their mineral levels. You say, oh my gosh, no wonder they've got insulin resistance. They've got inadequate fatty acid metabolism in their muscles, and GLUT4 transporter is not working. Well, you can actually measure a lot of these different metabolites in the body, like the organics test through Genova Metametrics will actually show you abnormal fatty acid or glucose metabolism problems, and you'll see the organic acids present. It's very straightforward. It's like, wow, it's this simple. You start to fix it by fixing the problems and getting people in proper exercise, and they don't need all the drugs. You start tapering the drugs, and before you know it, they're on no drugs. It's pretty amazing, isn't it? One of our best diuretics, by the way, is Simple Power C+. It's a fantastic diuretic. But you got to use good dosages, at least 3 capsules twice a day or more. When we come back, we'll hear more amazing formulas, and of course my favorite are the drinks. The drinks. I'm going to make another big ninja blender at the end of my program today of my favorite drink, NUTRIMEDS Super Drink Energizer. Welcome back, and Ryan, we have a lot of people don't often think together, for example, the cause of migraine headaches, because I get a lot of consults on migraines, and I was just reading an article written by, I'm not going to mention his name, but he was talking about what kind of things that they recommended you should do, and it's actually pretty good. But there was an article in the Prevention magazine saying, well, you should consider, and this is I get a kick out of these prevention magazines, they will combine things like yoga and so on, and then they throw in drugs. Like they had an article, the pills that keep women afloat. And I thought, I can't believe these guys are comedians. The pills that keep women afloat. Or they talk about migraine prevention. And their idea of migraine prevention is, well, you may need nasal steroids, or you may need an antihistamine, or you may need things. No. You need nasal Silver 100. You need antihistamines that actually destroy histamine, like Allergan. You need natural, non-sedating, non-crossing the blood-brain barrier antihistamines like Allerblock. You need to get rid of the pathogens with things like our Allicin Med in your sinus cavities, because you'll not only kill bacteria, but viruses and mycobacteria and fungi. A lot of times people don't realize you've got a whole nest of different pathogens growing there, including long-acting viruses like rhinovirus that can grow in people's airways or bronchi for years. They used to think that cold virus and rhinoviruses and so on were only temporary. That's not true. When you start taking away the cytokines with Allergan and Allerblock and killing off the pathogens, then, of course, with migraines, I tell people bite a CoQ10 Supreme under the tongue, take a Power Methyl B12 and suck on it under your tongue, and open up a capsule of Vein Away and put it under your tongue, Vein Away, and simply apply the limit photon pad at the back of your head between the base of your skull and the top of your upper thoracic spine, and it turns the migraines off immediately because that's the nucleus trigeminalis. We know anatomically triggers off the trigeminal ganglion in the sphenopalatine fossa in the back of your throat, behind your throat, that actually causes migraines. So, CoQ10 Supreme, Power Muscle B12, and Vein Away, these will turn off migraines very, very quickly. The CoQ10 is amazing. And, if you take it preventatively, you just won't have migraines anymore. They just don't even get started. You don't get the visual striae or fortification striae. You don't hear the hearing changes. You don't get the crawling kind of vibratory sensations or nausea or vertigo or any of the other symptoms that can tell you a bad sign of a migraine's coming on, because it can take a day or two to happen. So Ryan, let's talk about this for a minute, because people don't realize as you start normalizing brain chemistry, you don't need all of this garbage. Steroids? Come on. Like, why are doctors still pushing this crap, And they're dangerous. I mean, they interfere with brain chemistry, they interfere with your adrenal glands. If you take them too long, they'll actually suppress your adrenals, and a lot of people walking around on low-dose steroids, their adrenal function is shot. I mean, they can't tolerate any stress.
Yes, that's absolutely right. And there's, like you just bringing up the CoQ10 issue.
Yeah.
I mean, when
CoQ10's
we're
a big
talking
deal.
about energy deficiencies and so forth, especially over the age of 40, it's fairly imperative that people deal with CoQ10. It's very, very common. It's kind of like when you're doing the blood work for vitamin D. You find that it's more likely you have too little than too much by a vast amount.
Exactly, yeah.
So, the medicines we take, the lifestyles we lead, the lack of specifically organ meats that we consume, chances are we end up with the deficiency in CoQ10, and that reflects then on our energy production. Now, people know about CoQ10. It's the third most popular supplement in the world that's used. Unfortunately, what they don't know about CoQ10 is absorption issues are pretty problematic, in the sense that the material itself likes to crystallize, and once it does that, it is not absorbed. So people have seen CoQ10 move from powders into oil format, and that's as a to try to prevent some of this from happening, and to enhance its absorption by surrounding it with fat at the same time. But it still has left a lot to be sought after, and that's what these formulations have changed with CoQ10 Supreme and CoQ10 Supreme Ubiquinol. Both of them, enhance the absorption so you can get those blood plasma levels up to where they're going to make an impact on the body and move into a protection mode.
I had my, of course, I take the CoQ10 Supreme and CoQ10 Ubiquinol, and the lab was shocked at how high my levels were. I mean, if you have anybody with myofascial pain syndrome, chronic fibromyalgia, chronic fatigue syndrome, cardiovascular disease of any kind, hypertension, heart failure, any problem at all like diabetes, peripheral neuropathy, anything at all that deals with low energy, chronic, there's nothing like taking CoQ10. And I tell people to take both, because your body has to convert back the CoQ10, which is the ubiquinol, to the ubiquinone, the CoQ10. And I usually recommend you take, the average male should be taking 2 CoQ10 Supreme twice a day and 3 CoQ10 Ubiquinol twice a day. And then you can measure your blood levels through labs like Genova Metametrics. Will actually measure through the cardioion panel your actual levels in your blood cells, intracellular levels. It gives you a real good idea of exactly where your energetics are. And the problem with a lot of the quote normals that are quoted even by these functional medicine labs, we don't have normals. Where do the normals come from? Are they from another planet? If they're eating North American food, even food from other countries, they're going to be mineral depleted. They're not, even organic food isn't really organic, even compared to 100 years ago. When you start actually seeing clinical improvement, you're getting real high dosages of CoQ10 in fairly serious health conditions like chronic fatigue syndrome or even dementia. CoQ10 is neuroprotective of the brain. So is DHA. So is acetylcarnitine. Those are 3 biggies. When we use Cognition Plus, CoQ10 Supreme, and DHA, which is our neurogen, you can dramatically protect the brain tissue from any kind of dementing illness or vascular problem or recover from a stroke. It's a really big deal, isn't it?
Well, I mean, only if you're interested in preventing things like dementia and Alzheimer's and
you're a comedian too,
I guess.
Only if you want to not drool and end up being put in a like with Obamacare, which is really he was off golfing. He actually didn't invent it. He just put his name on it. There were 3,000 lawyers that invented it for the drug companies and the insurance carriers, and so they put his name on it so he could be the punching bag for it, and everybody could criticize Obama, although he likes to play golf and watch ESPN. And then watch the blogs to see who thinks he's great for a late-night TV show, because he's really a late-night TV show host that got recruited to be president. That's my joke there for the day. So what we have is with Obamacare, they go from inadequate care, which is kind of what I call paint by numbers, paint by the numbers and colors. Then you go to memory care, and then you go to hospice, where they give you a bathtub of narcotics so you float on to the next world. Just like you get in the boat and they put 2 coins over your eyes, like when in Viking mythology you go to Valhalla. This is sort of like the same thing. That's what Obamacare is like. They put the 2 coins over your eyes, or Obamacare coins, and send you across to the boat to the other side. Well, the thing is, if you don't want to do that, you better take nutraceuticals to protect your brain from cell phones, Wi-Fi networks, mineral-depleted soils with no selenium, chromium, magnesium, molybdenum, all the other trace minerals. You're not repairing your body. You're literally blocking your stem cells. A lot of drugs we give people, like the ACE inhibitors and ACE receptor blockers, actually turn off your stem cells. Do you know that? Take an ACE, an ARB, or an ACE. Bye-bye stem cells. Have a nice day. If you don't protect your brain glutathione levels, you get upregulation of glutathione peroxidase activity, downregulation, you get free radicals, and like when children get stack vaccines, their brain's on fire for years after they had these stack vaccines, especially if they have gene SNPs. They've actually identified the gene SNPs. There are 4 or 5 of them that are particularly linked up with autism. And I can prove it. So somebody says, I don't know if I can prove that. I said, wrong. You send me the gene polymorphisms from the gene analysis. We were doing this long before 23andMe was doing it. We were doing it through other labs like Genova and other labs. And you can prove it. So things like trying to protect your gut. We've got Ageless to heal the gut. We've got Life Support, which is a Roselle 6 strain from the Pasteur Institute. We've got Living Probiotic Ultra. You want to stop leaky gut syndrome? You can actually measure zonulin through Dunwoody Labs to actually measure how leaky it is, which is an upgrade from the old test, the lactulose mannitol test that they used to use at Genova Labs. So this is not guesswork. We can measure all the pathogens with DNA probes and everything in your gut with CDSA, and we can prove we can fix your bowel even if you have diverticulosis with our NutriMeds. Welcome back, and if you want to power up your day, you want to power it up with NutriMeds, I have finished I had my power drink this morning. I had all my vitamins. I had an hour of hyperbaric oxygen. I had a half an hour vitamin VX, vibrational exercise, with my body elastic bands, and extreme workout. And I can tell you, you're fit for the day. You're ready to roll and go through the day and tolerate stress because your adrenal glands are working, your thyroid glands working, your body's able to tolerate it. You want to protect your ion channels, Gamma A+. You want to build up your magnesium in your total body to tolerate stress. It's a stress mineral. If you get stressed, your body dumps magnesium. Magnesium glycinate, malate, and magnesium citrate, which will stop formation of kidney stones, gallstones, etc. Magnesium taurate we use for the heart. Let's talk a minute about Gamma A+. Why is it so important? How come it's so much better than the we call synthetic form of the D-alpha tocopherols? And of course, a lot of the other companies will be putting out a gamma product, and it's very inferior. It doesn't have all the tocotrienols, all the different range of gamma products to stop peroxynitrate radical, which is one of the worst in the body, and to protect your ion channels.
Yeah, it's a major issue, right? Cardiovascular disease is the number 1 killer in the United States, and most cardiologists are pretty much fans of vitamin E, except they start going and giving advice like, yeah, they'll take vitamin E, but they're not looking at the big picture of what kind of forms of vitamin E are you taking? Are you really mimicking the kind of natural organic foods you would eat in the plant itself, what it's going to deliver for vitamin E? What most people are getting is one type of tocopherol from vitamin E, alpha tocopherol, and they are missing out on some of the most powerful tocopherols, which are these components within the plant, like gamma tocopherol, which we know has the greatest scavenging effect on things that, like peroxynitrite, as you were just mentioning, the worst of the free radicals that are known. And so what happens is people often take with good intention a vitamin E product. It's loaded with gamma-alpha tocopherol, and I'm sorry, not gamma-alpha, but alpha tocopherol. And unfortunately, it's missing these other components, including tocotrienols. And all of a sudden, you're basically giving something that it's filling in these receptor sites that should be binding with gamma, beta, delta, the tocotrienol, and instead all you're getting is this alpha binding. And that's turned out to, it doesn't help, or in some cases, it may be actually harmful for somebody. So you've got to have this awareness, and that's, thank God for Dr. Bill and what he does with the Nutrimedical report, because otherwise it's really just buyer beware. You really don't know what you're doing. You go to a health food store and they say, hey, buy some vitamin E, and you're like, hey, cool, okay. You have no idea. In some cases, you're really just not only wasting money, you could actually be, doing stuff that's not helping you at all. It could be taking you the other direction. So you've got to be aware of these things.
Yeah, by the way, and don't assume because you go to a naturopath or doctor who's doing functional medicine, depending on their level of knowledge, that they're using products that are superior enough that they're going to help you. For example, if somebody says, hey, doc, I went and my cardiologist did high-speed CT and I got calcified arteries, I said, how do we reverse it? Well, the first thing you do is get the right fatty acids, like we mentioned, omega supreme, krill, etc. But you need to be taking things to reverse the lipid disorders, and Gamma E Plus is there. Omega cod liver liquid is actually head-to-head superior to the HMG-CoA reductase inhibitors like Crestor, Lipitor, Zocor. These are nasty drugs. They shouldn't be given to anybody for any reason. In fact, there's now a big lawsuit, and these legal firms have got advertisements all over cable television, satellite TV, and direct TV, that they know that HMG-CoA reductase inhibitors induce diabetes, proven in women. Now, they probably do it in men too, but they also induce heart failure. So if you got somebody that's diabetic or already has heart failure or vascular disease, you actually increase the chances they're going to get in trouble, because it's inadequate fatty acid metabolism in their artery walls that actually induce plaque. So it's all tied together. Amazing, isn't it? So, Ryan, let's talk about that for a minute. So we got the Gamma E. We've got magnesium glycinate malate as well. Let's talk about that, because total body magnesium, if I was going to say is there one thing that I want people to correct in their minerals, once you get your magnesium levels up, you can take NDMEs, you can take your Vitamin Mineral Max or Minerals Plus. You can have all of the drinks which contain all of the trace amino acids, minerals in their trace amino acid chelates, and all the activated forms of vitamins, because many of these vitamins are necessary to maintain the proper oxidative state in the cells. And it's so straightforward though in some ways, and so out of the ordinary for the average practitioner. Even ones doing alternative medicine, it's like it takes a little more effort. But this is the only way to actually fix the problem, is to identify what's going on. It's like an electrician. If you don't put clamps, the alligator clamps on the wire, you don't know what's on it. Is it a live wire? Does it have, electronic interference on it? Does it have electro pollution? If you don't use the testing devices, which we talk about on Tuesdays, usually with Emil de Toffel, you don't know. Well, the same thing goes. We put together a kit for protection against Ebola. In fact, I just saw recently we had a gentleman down in New South Wales, Australia, that ordered it. Now, part of that is to simply start protecting yourself from all the stealth pathogens. Your body is constantly under the attack of pathogens. Allison Med will help protect you so you don't get sinus, bronchitic, or arterial infections. It knocks out the nanobacteria that cause periodontal plaque and cause plaque in your arteries, because the nanobacteria are necessary for that reaction to create unstable plaque. So if you're hypertensive, diabetic, dyslipidemic, if you're not on Allison Med, why aren't you? And you're not only that, your chances of picking up an airborne pathogen like the flu in an airliner, or the stupid World Health Organization that says after hundreds of doctors and nurses die, they're wearing biological protection from airborne pathogens, and they say, well, it's not airborne. Come on, WHO, get with the program. You guys are malignantly stupid. Of course it's airborne. Of course it's damn well airborne. You know that. They did a study with monkeys years ago, and now monkeys do manage to throw their fecal matter around the lab. But they've had one monkey on the other side of the lab, and then the other monkey, and of course in between our laboratory techs walking around with our white lab coats, and the other monkey, without any physical contact, got Ebola. And this is years ago, about 20 years ago. So that's the old version. The new version now will incubate through 3 weeks. Well, you want that. You want to take our Silver 100, which is, unparalleled. You want to take our Nutriodine. But you want immunoglobulins too. You want to be taking Immunomax or Nutrimune. You want to be taking Ageless. I tell people that have had irritable bowel syndrome, and they start taking our things like IBS care. They start taking CoQ10. They start taking things to heal their gut wall like Ageless and Allergon, Allerblock, and they cut out their foods that they're allergic to based on testing or a functional rotational diet. I like the testing because you measure IgG and IgE antibodies. And they just cut out all GMO foods, and all of a sudden they say, I can't believe it, doctor, I have no problems. My bowels settle right down. So what's quite amazing to me is how quickly the body will heal if you give it a chance. Things like taking our gastro cleanse. We have the Saccharomyces boulardii. I call it the bouncer of the bowel, and gastro heal. This will, even if you've got the pregnancy nausea. I just had a consult last week. We gave the lady zinc carnosine, the gastro heal, and her pregnancy nausea just went away. Now, do the conventional doctors have anything for that? No, of course they don't. They don't even have the mechanism because it's a bile gastritis. It's caused by retrograde bile gastritis in the lower stomach. They don't know that unless they scoped it. I worked with gastroenterologists over the years, and we postulated that it's actually abnormal peristalsis induced by the progesterone that causes bile to reflux back into the lower stomach. Do the other doctors know that? No, they don't. They don't have the experience or knowledge to realize, and they start taking GastroHeal, and it stops not only hyperacidity gastritis, but also bile gastritis, or abnormal peristalsis, too. We have a number of people with digestive problems. We have Gastrozyme. Tell us about that and the digestes, because my most recent QRMA test indicated I had an 11-year-old, believe it or not, that needed digestive enzymes and Gastrozyme and digestes, because they're eating all kinds of garbage. You look at all the nutritional imbalances on their QRMA, it's like, this kid's not eating right. They're just going from one fast food place to another, or picking at their dinner. They're just not eating the stuff, like shoving the veggies aside on their plate. They must not be eating them.
Right. Yeah, and so these formulations, the probiotic side of things that you just mentioned, I can't say enough that there's so much that we're doing to our bowel to kind of destroy the ecology. Sugar, stress, as we get older, alcohol gets inclined, but also the use of antibiotics, as you were talking about, how to defend your body. Well, most people are like, well, I'll go to the doctor and get an antibiotic or something like that to kill it off. Unfortunately,
no.
They do a lot of whole damage to the gut lining, which then perpetuates the problem over and over and over again. And so, do not forget about Living Probiotic, and especially Living Probiotic Ultra, where you're looking at 100 billion active organisms per single capsule. Most powerful one that people are going to find out there, and these human strains that have been shown to have this benefit, not just in the gut lining to help balance it out and stop things that are going on there, but also systemically how the immune system is working, how the killer cell function is happening. So all those things add up to greater protection.
Well, you know that old saying, happy wife, happy life? How about happy bowel, happy life? How's that?
Start with yourself.
Happy bowel, happy life. Pretty good, hey? Thank you, Ryan. We'll see you again on Monday. And back in a moment with hour number 3, Tim Alexander, top of the hour. Major updates on what's going on with Fukushima with Chris Harris.